My name is Brian Krieger, and I'm founder and president of Katallasso, Inc. And I'm here to tell you a little bit about where did we come from and why. So we were formed as Katallasso, Inc. instead of Katallasso Family Health Center because we always knew that there would be other ministries that we would grow underneath that banner of Katallasso, Inc. So obviously, Katallasso Family Health Center, which is where we're located right now, was the first ministry to come out of Katallasso, Inc. So why did we do it? The main reason that Katallasso, Inc. was formed was to be a catalyst to pull the Big C church together like we were originally formed by Jesus Christ himself. And honestly, we don't do a great job of that. We human beings kind of came along and we split it all up into different factions and different denominations and the like. So we want to be a catalyst to pull the Big C church together in order to take care of some of these social needs that we know exist that either the church has given up or the government has taken over. And frankly, you can have that argument all day. So what does Katallasso itself mean? Katallasso means reconciliation in Greek. We believe that when you help somebody to reconcile with God, church, family, and neighborhood, when those four relationships are working properly together, it can take somebody to a potential that they didn't even know existed within them. So when you look at our primary demographic, and I say primary because it's not everybody, but it's a vulnerable population that's having difficulty, that's beaten down and discouraged. And we want to provide encouragement to those people. And honestly, we also want to expose them to Jesus Christ, because we know that in God's Word and through Jesus, that's where the hope comes from. And for that population, for this population, it is what they need. So people ask me all the time, Brian, but why did you get into this? Frankly, my background is, at the time of this filming, I was a manager for Giant for 23 years. About 4 or 5 years ago, I went part-time because of a couple of convictions that I experienced while in my local church. And God just spoke to me and said, Brian, you need to do more. God's Word tells you you need to be doing more. So I set out on a couple different things, and this is where I landed. We opened on January 7th of 2013. Now, it took us about 2 years to get to the point of actually opening. We spent a lot of time making friends, making sure that there was an actual need for Katallasso Family Health Center. Another thing that Katallasso Family Health Center desires to do, on top of being a catalyst to pull Big C churches together, is we want to collaborate with other organizations and parachurch organizations. Because once again, we're all part of the big church. It's not just churches and church buildings, but it's other organizations that are trying to do the same thing we're doing, but we want to look at it in a more holistic fashion. We might take care of the health care part of somebody's life, but there are other fantastic organizations out there that are doing great work in their particular field. So again, we want to look at it with a holistic approach. So here at Katallasso Family Health Center, we work hard to impact lives, not just from the medical perspective. You know, we often say somebody could come in here with let's just say a pain in the side or a flu or something. But the fact is, we could take care of that most of the time, but 2 weeks later, they're still dealing with the issues of life. They could be dealing with, I don't know, addiction, domestic violence, dysfunction in the family. So many different things could be going on in somebody's life, and that is where we can impact somebody's life. Sure, we're here as a medical center. We want to take care of those physical issues. But think about it for yourself. When you're feeling most vulnerable, it's when there's relationship issues, or when other things, anybody would give their left arm for a positive relationship or a great relationship with their spouse or another family member or a friend. And that's usually where people really are struggling. But they come in here for physical health care, and we take care of that. There's no question, high quality health care. But we want to get to some of those other issues, where the real issues lie in somebody's life. So we provide biblical counseling, and we're all about the relationship. We want to develop solid relationships with people so that at some point we might be able to speak into the rest of their lives. How do we do that? We give them time. We give them time, which is not what you find in your typical doctor's office. Some of them provide that, but that's one of our main focuses. So that's how we really get to know our patients. Our goals are first-time visits, 45 minutes. Second-time visits and follow-ups thereafter, 30 minutes. Those are our goals. So that allows our staff and our providers to really get to know a patient and ask questions beyond the physical. What's going on in your life? Are you married? How are your relationships at home? And some people don't want to get into all that. And that's perfectly fine. Because what we have found is that in the beginning, they might be a little bit closed up. But as they come in here and they experience the love of Christ, they start to open up. When they start to recognize that we really care about them and that we love them, they start to open up. And that's just absolute key. It's the relationship. Because sharing the love of Christ is more than asking somebody to make a decision. It's about the relationship that builds up to that point. So that's our goal, relationships with people. You're probably noticing that our facility, it's a very nice facility. And in fact, most of our providers will say this is nicer than their own office because our providers have their own jobs and they still practice, most of them, privately. It's a beautiful facility because we wanted people's dignity to be raised as they walked in here. And we believe that sharing the love of Christ starts with the physical plant. So our board came into this very room. I'll never forget it one time. And I said to them, do you want to re-drywall this? Because when we got here, it wasn't in the greatest shape. So I asked them that, and they said, Brian, how much is that going to cost? I said, well, I've gotten estimates, and they're all around $10,000. It ended up being $12,000. But anyway, the estimate was $10,000. And they said, Brian, how much money do we have in the bank? I said, $432. I'll never forget it. And you know what? We stepped out in faith, and we did have it all drywalled. Because you know why? We wanted to raise the dignity of people that came in here. We want them to forget that they're even in a free health clinic. Because most people that walk in here, they have kind of this image of what a free clinic looks like. This is usually not it. Usually they hit our door and they realize this is a different kind of place. And you know what? We want our clients to experience that and forget that they're in a free clinic. Because honestly, our main demographic, again, not all, but our main demographic has been to these free kind of services. And frankly, usually the facility looks exactly like that, a free facility. You know, this was a $200,000 renovation that we actually were able to put out only about $140, $150, because the rest was gifts in kind and donations of labor and time and that kind of thing. But people always ask us, Brian, where's all your funding come from? And I'm so proud to say that less than 1.5% of our money so far, in the couple of years that we've been operating, comes from government sources. The rest is private. In fact, 45% of our money that comes into here is just individuals writing checks. And naturally, we get money from churches, different civic organizations, family foundations, and grants from different organizations. And that's where our money comes from. So we're not just another government agency. And you know what's really cool about that is the fact that we don't have to live by the parameters that they provide for us for the patients that we see. We don't have a checklist that comes in from a government agency saying different things like what's their income level, tell me about their bank accounts, tell me about where they live, do they own their house, do they rent? We don't have any of that. You know what? We can look at an individual and determine just by grace, just by mercy, is that our kind of client? And what's important about that is sometimes somebody will come in here and yes, they do have insurance. By the way, 92% of our people don't have insurance, or at least they tell us they don't have insurance. But sometimes they do have insurance, but there might be a reason that they can't avail themselves of that insurance. Maybe the deductible's too high. Maybe the premium's too high and they've pulled out of insurance, or they're about to because of that premium. There's a lot of different reasons. Maybe there's a divorce situation. Maybe they're new to the area. There's so many different reasons that somebody could be coming to Katallasso that do have insurance. But again, it's really a small amount of people that come here. Less than 1% of the people that come to Katallasso are children, because Pennsylvania does have a really good program called CHIP. And most kids can, in fact, all kids can enroll in that and qualify for it. But sometimes we do see children. Usually there's a special reason. They might be new to the area. Sometimes we run into these situations where a child will have lice, just as a for instance. They might have lice. They might have gotten rid of that lice, but they need a doctor's note to get back into school, and they can't get into their family physician for 3 weeks. Well, that puts them out of school for 3 weeks. So that's just not right. So again, we want to show them the love of Christ here at the center. So we get them in, we check them out, give them the note, and send them off to school. That's happened a couple of times. What was really cool was when we came together for our first demolition day. It was a Saturday, I'll never forget it. We had 42 people here from 9 different churches. Remember, one of our keys is to pull churches together and people from various churches to interact and do things like this. So it was awesome, and we got it all tore up. You should have saw this place. It was amazing. But the next Saturday, we had 45 people here, all volunteers from 11 different churches. Frankly, I'm more excited about the 11 different churches than I am the 45 people, because that was one of our goals, to pull churches together. And that just gave us kind of a blossom that just worked from there. That even at our last staff meeting, we had 17 different churches represented. And that is awesome. And it does, again, back to denominations, it doesn't matter. We had Catholics there, we had United Methodists there, we had Lutherans there, and of course we had fundamentalists there. So it's incredible, and I know there's much more than that, but that was one of the keys. So we came here and we tore it up, we built it back up, and here we are a couple of years later, having served over 1,000 clients at the filming of this. But it's been an awesome experience. I could just tell story after story after story of people that came in here downtrodden, hurting, struggling, just had people that, we have a couple patients that just had strokes, that they come here for physical therapy. And the tremendous difference that that's making in their lives has been incredible to watch. One of the other things that excites us here at Katallasso, and one of our goals, is to bring people groups together. We don't want to be just another white church group that comes from the suburbs, comes into a neighborhood and into an urban neighborhood, and we decide what the need is, and then we provide for that need, whether the neighborhood thinks they need it or not. So it was very important to us right at the outset to determine if the neighborhood felt that they would like to have our services. So what did we do? We started going to neighborhood meetings, community association meetings, and talking about what we would like to do here at Katallasso. Once we decided that this was probably the neighborhood we would like to provide our services in, we went to the neighborhood and we said to them, we need a letter. We need a letter inviting us to the neighborhood, signed by the residents of the neighborhood. Because again, we didn't want to come in here and so arrogantly just drop our center in the middle of an urban neighborhood and say, this is what you need, this is what we think you need. So here we are. We wanted them to identify what the need was. Naturally, they did give us that letter, and it was signed by probably 15, 20 residents, and then we knew this was going to be our home here in the Salem Square neighborhood of York City. One of the things we recognized was that sometimes rural church groups will come into urban neighborhoods and do cleaning and do different things, but they kind of leave the neighborhood and they feel good about themselves and they've done great work. I mean, honestly, here at Katallasso, we've had groups come in here and do work for us that have done tremendous things that we couldn't have done ourselves. But we wanted to be a permanent fixture of the neighborhood for a couple of different reasons. One of the things we wanted to do that was important was we wanted to make sure that we were reaching across people groups. Because naturally, I'm a white male, but the neighborhood I'm in has a lot of different minority populations. So one of the things that's very important to us is that we're able to reach across those cultures and get to know people, where they live and who they are. So that is one of the important things. And we try to reflect that actually in our staff. But we're out amongst the people. We're doing different block parties, and we're doing different community events. So we're out in the public as much as we possibly can be. And that's amongst whoever. We don't care. Because frankly, as a Christian organization, Scripture doesn't see color, and we don't want to see color. So I'm happy to tell you that, our population of patients here, as we're taping this, it's about 40% white, and the rest, I think it's about 24% is black, and there's about 18% is Hispanic, and then it goes on from there. So we wanted to reach across all populations in our staff and in the clients that we serve. It's very important to us because that's such a big issue in society today. So let's talk a little bit about our staff. At the time of this filming, we have about 13 providers that are working here. I say providers because that includes medical doctors, nurse practitioners, and physician's assistants. And the specialties that are represented on that board-certified group are, of course, family practice, infectious disease, gastroenterology, endocrinology, orthopedics, and women's health. So that's a lot. So we're able to provide a vast array of services here at the center. Anything beyond that, or anything that needs an x-ray or something like that, we talk to people that we're in relationship with. For instance, we send people out occasionally for various kinds of small surgeries. We actually had one guy one time that actually had cancer removed from the top of his head. So we do a lot of different things. Of course, that wasn't done here, but again, we have relationships with various other organizations that are able to provide this charitable care. We also have a fabulous core of nurses and admin folks. All our nurses are state licensed. Most of them are RNs. And we, again, want to provide a high quality healthcare experience for our clients. But again, we're all about relationship. So every one of those providers is a professing Christian. So they are here because they're walking out their faith. They came here looking for an opportunity to use their skills to, in an environment just like this, and frankly, we provided it. So they are here loving on people, and you know what they love is the fact that they can practice medicine here in a way that they intended to when they went to school, and then they kind of got out into the real world and saw how it really worked. Again, I say, not that all doctors' offices are just pushing people through, but frankly, well, we've all had an experience where it was a 10-minute visit, and we just kind of really got to the point. What's the matter with your elbow? Tell me everything about your elbow. But didn't really dive in to what the real issues of life are that might be causing all those. In fact, we use around here a thing called the Model for Healthy Living. And on that, it's a wheel that has about 10 different attributes of a person's life. Might be spiritual, might be mental, might be emotional, might be nutrition. All these different areas, family, make up a person's whole life. And that is what we encourage our providers to focus on. Sure, we want to take care of that medical issue, but we really want to get back into their whole life. So each one of our providers is trained to do just that. And we ask them to take time, and it's honestly, most of the time, hard for a provider to slow down because they're so used to that fast pace wherever they're working currently. But they come here and we encourage them, slow down, talk to the folks, develop that relationship. So again, it's all about relationship here at Katallasso. One of the questions people always ask me is, Brian, where do you get these providers and where do your volunteers come from? And my answer always is, I don't know. It's always amazing. I had a provider walk up to me in the grocery store one day, and nurses and admin folks and providers come from just different churches that I might be in speaking, and it's amazing how many times it's a volunteer knows this person, knows that person. And you know what? I can only attribute that to the hand of God, because we have a fantastic staff here. Again, we're at about 13 providers. So they come out of the woodwork. It's amazing where they come from. And sometimes it's really interesting just to hear the story of how they got here. Because I'll never forget, one of our women's health providers was just a friend of one of our admin folks. And they got them hooked up, got them in here, and they were looking for something to do. Instead of always having to fly across the world to serve, they wanted to be able to serve locally, because then they didn't have to get plane reservations, save their money, leave their practices for weeks on end. So these all proved to be a good reason for them to come to a place like Katallasso. I also want to mention that here at the center, we provide services that, again, are just like any other family practice. We do labs. We even do EKGs here, and I don't think most doctors' offices even do that. And we provide a certain amount of medications to folks, the things that we have. Now, we don't do narcotics here at the center, but we do provide a certain amount of medications to folks when they need them. And you know what? There are those rare occasions where somebody will get a prescription and they just can't afford to pick it up. So we'll go pick it up for them, and we'll pay for it. So we again want to share the love of Christ the best way we can, but we want to be very responsible and great stewards of our donors' money. So we are cautious a little bit. We do ask a lot of questions, but we really want to get to know our patients and get to know why they are coming to a free clinic, especially if they have insurance. But it's all about the relationship. I want to thank you so much for your interest in becoming involved here at Katallasso Family Health Center. Without people like yourself that are willing to step up and become involved here, walk out your faith, serve fellow man, and to be obedient to the dictates of Scripture, this place couldn't exist. You know, we're over 1,000 patients now, and each one of them have been impacted by a volunteer experience that has truly touched their lives. And I want to thank you for your interest in being involved here at Katallasso.